Welcome to Beyond the Flare, a podcast from IFPA created in partnership with Johnson & Johnson. This is a space where voices from across the global psoriatic disease community come together to share experiences, insights, and ways we can shape a healthy future together. I'm your host, Yanina Kostakaite, and today we're going to explore psoriatic disease and comorbidities, including the importance of lifestyle modifications, routine screening, and how different experts can work together for better care. But first, let's get to know our guests.
I'm Álvaro González-Cantero. I'm a dermatologist. I'm also a researcher, both in the field of psoriasis. So I dedicate my time to psoriasis, both seeing patients and also doing research. And mostly my line of research. So what I do for doing our discoveries is mainly based on comorbidities. So I'm very happy to be here with all of you in order to deliver this very important message.
Hello, everyone. I'm Kathleen Gallant. I'm living in Pittsburgh, Pennsylvania, in the United States. I've had psoriatic disease for 48 years and have been a longtime advocate, not only for myself, but for other people in my community and around the world, to help us all live a better life, understand our disease, and speak up for ourselves for better access to treatments.
My name is Miriam Zimmermann. I am a medical advisor for the EMEA region at Johnson & Johnson and work in immunology, more specifically in dermatology in psoriasis.
So much expertise we have here today. And to start or to frame the discussion, we usually begin with a big picture question. And Dr. Álvaro, why do you think it is important for people to understand the comorbidities associated with the disease?
Well, I think this is an important question when we talk about comorbidities because many times patients with psoriasis, when I see the patient and many doctors also, we are only focused on one of the most important thing, which is the skin lesions, which is so relevant for patients and doctors, mostly in the short term. But we now know that there are other issues that patients with psoriasis should be aware of. And sometimes they are not, let's say, there are some misunderstanding about them, or many people don't know about, such as, for example, heart disease that we will cover later, or psoriatic arthritis. So this is something that we should give awareness, mainly because of one reason, because they are preventable. We can prevent them.
Miriam, when you think about this, what comes up for you around the importance of understanding comorbidities?
I think it's important to be aware of the comorbidities for the patients, but also for the physicians to be able to be treated holistically, because psoriasis is a systemic disease, so it affects a lot of different areas and different organs as well. But also it's important because if those comorbidities are not identified early, they present later. And when they present later, they're also often harder to treat. And that also means more burden to the healthcare system and ultimately higher cost. But of course, it's also more tricky for the patient because a comorbidity might be established, while when you treat early, as with many other diseases, when you treat early, you have a better chance of resolving things or reducing the burden.
And Kathleen, from your perspective, from lived experience, why do you think comorbidity awareness is so important?
Well, when you're not aware of the comorbidities, they could be happening inside your body and you don't even know. In my case, when I was diagnosed 48 years ago, no one had ever heard of psoriatic arthritis. I was exhibiting joint pain very shortly after diagnosis, but it was misdiagnosed and went unchecked for 15 years before I had a diagnosis. By then, I was permanently disabled with joint damage. I even have trouble speaking and opening my mouth because I have joint damage all through my spine and jaw. Another big thing, I think, is mental health. I mean, there is a huge connection between psoriatic disease and mental health and inflammation. And not only do we have mental health issues because of how we're feeling and how others perceive us if we're exhibiting psoriasis, but also the inflammation that can actually cause depression in the brain. And I think that this is another key thing that patients need to be aware of. This needs to be discussed right in the beginning. Also, to tell a patient or their caregiver about being screened for diabetes, cardiovascular disease. We all usually get our blood pressure checked, but it needs to go deeper into that. And once we realize and understand this, as Dr. Alvaro said, we can take steps to prevent or at least cut down on the severity.
Thank you, Kathleen, for being so open and really sharing your journey bringing up mental health. And I would like to build on that a little bit. Dr. Alvaro, do you see similar comorbidities in your patients or anything else?
Yeah, so I think that's the most common comorbidities. So the way I see this is I want to be sure that I cover all these things at least briefly in a first consultation with me. I cover some main points, like maybe 4 points. Like I ask about symptoms of PSA, of course. I ask about uh, some factors for heart disease, like cholesterol levels, family history, smoking, diabetes, all the cardiometabolic sphere. Obesity is really relevant in psoriasis. It's really frequent and associated to the disease. And of course, what I like to cover mainly at the end of the first consultation, when I have a good relationship with my patient, I always touch the psychological sphere. And you can sense a little bit what's behind or beyond, like this podcast, beyond the all the things, all these lesions in the skin. Those 4 points are for me the main things that I want to cover at the beginning of my of a consultation with me.
And now I'm curious, are these questions asked only in the initial consultation or is there a need for routine screening?
So usually after 2 consultations or 3, maybe we have done a good job with the skin. These days we have good drugs and good treatments. So if the skin is clear, it's where I used to start checking the cholesterol. I start to try to maybe propose I don't know, a starting therapy or how to work with obesity or those kind of things. But I agree that what you cannot do is having a patient with all the stigmatization that Kathleen said, with all the problems and psychological impairment, and then also telling them, and you also are obese, and you have to take an statin, and you need to stop smoking. So I like to be empathetic and to put in myself in the skin of the patient. So what I've learned is, okay, we first cover the skin, and then we go slowly. This is a chronic disease, and we have time to be working on each one of the components. So my answer is yes. We routinely cover all the comorbidities. So it's something that you need to be continuously. I like to ask proactive questions, like for example, okay, which thing should I cover now in this patient? Because these days in psoriasis, sometimes patients come to the clinic and it's just to say hello because everything is good. So that's where we need to be proactive. So yeah, I like to do this continuously and over time, and try to feel and sense what's needed for the patient.
Thank you for elaborating on this. Miriam, picking up on what Dr. Alvaro just shared about systemic risks, I would love to hear your perspective working within the industry. What are some of the most common misconceptions you see around psoriatic disease?
So we know it's a systemic disease. We also do a lot of medical education from company perspective, so that in our symposia, for example, we address those risks and that it's a systemic disease. But we still have the feeling, and that's also what we hear from doctors, that they need to come together a little bit more. One of the challenge for physicians is very often that they don't have a lot of time. And that, of course, puts a lot of challenges onto the treatment, the holistic treatment of patients. Because if you don't have a lot of time, you might ask your patient, how are you doing? And the patient might just say, fine. But it's important to actually look underneath that and also for the patients to be informed, right? Because if a patient is informed, if they know what other comorbidities could come up, what other challenges could come up, they can actually directly inform the physician and therefore save precious time to actually come to a proper conclusion and how to move forward with this.
And Kathleen, we've been discussing misconceptions and the idea of patients being these strong advocates in their own care. So we want them to be informed. They want them to be in collaboration with their healthcare provider. But Joel reminded us in episode 3 that lived experience can be very different, that not every doctor is like Alvaro. So when you think about your own journey, how did your awareness, or maybe sometimes even uncertainty around systemic risk, influence the decisions you made for your health?
I realize that I have to be my own advocate every single time I see anyone in my healthcare practitioner team or beyond. I am the one ultimately that's responsible for my health, and I feel that it's or just critical that we all understand what psoriatic disease is so that we can be our own best advocate. Well, I've had to switch healthcare providers because some of mine have retired, and working with new doctors, I haven't felt comfortable, but I've had to say, I'm here because of my psoriasis, but I'm also aware of the comorbidities of psoriatic disease. And I kind of step forward a little bit and not wait because I want to make sure that my healthcare providers know that I'm aware of all of the comorbidities and that we take them into account when we're addressing my psoriasis or my psoriatic arthritis, because I am a whole person. I'm not a sum of parts, even though I go to 5 or 6 different specialists for different parts of my body. It's all coming back to psoriatic disease. So I think it's very important for us to be educated and aware of what psoriatic disease is. And when a patient is looking for that information, it's everywhere. So you need to go to trusted sources. And I'm just going to throw it back to IFPA and our website where we have the comorbidity guide here. And if you feel that you're not getting the care or the screening that you need, because I have asked quite a while ago, well, shouldn't we be checking my heart? And this was maybe 15 years ago when I first became aware of the link and to psoriatic disease, and the answer was no. You're not old enough. Well, let's not worry about it. And I thought, well, that's not the answer that I wanted to hear. And so I had to insist. And I went to a cardiologist and said, and luckily he also was very aware of psoriatic disease. And he said, absolutely, we need to monitor you every year because of your age and how long you've had psoriatic disease. So being able to speak up about it, I had to insist on that because once again, it's my responsibility. It's my health in the end. And I need to make sure that I'm getting the care and the screenings that I need.
Well, thank you, Kathleen. I think your experience really shows how layered these decisions can be and how much support people need along the way. And I would like to get back to Alvaro. Do you think that multidisciplinary can, and if yes, how, help prevent long-term complications? We can talk about maybe lifestyle factors as well, diet, stress. Do these play a role?
Yeah, for sure. I think that we here know that, for example, psoriasis can affect other organs that have other implications, but sometimes we go to other doctors and they don't know. They know nothing. They don't know about the heart disease. In my hospital, for example, when I arrive, I do research on psoriasis and heart disease. Now they know everything about that, but before they didn't know. So I think that awareness is, of course, important for patients that are out there, but also for healthcare professional outside of dermatology, also in dermatology, but also outside there. So, for example, I treat my patients together with a rheumatologist once a month, and that's been a huge improvement for the healthcare of our patients, because even the rheumatologist is learning. She's learning from me. I'm learning from her. So our patients are benefiting of having four different eyes looking at them, like two dermatology eyes and two rheumatology eyes, and we improve together, and that's so relevant. So multidisciplinary care is really relevant, and also, for example, when endocrinologists now they are starting to recognize psoriasis as a cardiometabolic disease, so they take care about the diabetes earlier, they take care about the obesity early, and all these kind of things. So multidisciplinary is really relevant. Having said this, I'm very happy to share that my group, after more than 2-3 years of research, we have published the largest clinical trial of an intervention with diet in psoriasis. We have published in JAMA Dermatology. In JAMA Dermatology, we have recently published from my group the first and the most, let's say, relevant diet study in psoriasis, and it's on the Mediterranean diet. So we have demonstrated an improvement of 4 points in the PASI score, which is the way we measure the severity of the disease. And you may have a question: what is the Mediterranean diet? 3 pieces of fruit a day, 2 portions of vegetables, then nuts most of the days of the week, olive oil to use in the main in cooking, and then prioritizing fish among meat, and of course trying to avoid processed food. So without any doubt, things like diet, exercise, sleep, all these kind of things, they really matter for psoriasis patients, and not only in the skin, but all the things that worries a patient, like all the psychological impairment. It can be benefit if you can do exercise or if you can sleep bit, but it's also difficult because sometimes the skin disease or the joint disease is making you difficult to do these things. So it's something that needs to be addressed in the clinic, for example, or in the education of a patient with psoriasis, and not only focusing on the drugs or on the treatments.
These are really fantastic tips, and I hope more research will come out on diet and lifestyle changes with association of psoriatic disease. And now I think maybe Kathleen, you could share something. What would you tell to maybe newly diagnosed people living with psoriatic disease about managing their overall health? Do you agree with what Alvaro just mentioned?
Oh, I do. I am in a terrible flare for the last 6 months, joints swollen, covered in psoriasis. And I'm working with my doctors to get it under control, and we're doing the best we can. But during this time, the only thing I can really manage is my self-care routine. I can manage my diet, and I work with a dietitian. I'm very fortunate. Of the last 8 months, she's gotten me pretty much completely on a Mediterranean type diet with some other additions to work with to settle my irritable bowel syndrome, which is directly linked with my anxiety. And I can control what I eat. What else I control is how much physical activity I do, and I know I have to move every single day as often as possible. I have my watch tell me at 10 minutes to the hour that I need to get up and move right now. And when my knee is swollen and I can't walk the way I want to, at least I can stand up and sway back and forth, because the more that I move my body, the less stiff and painful I am. And I also know it's good for my mental health. Sleep, again, is a huge one. And that's really hard when you are so itchy and so much pain. But there are techniques and things to do to try to calm yourself as much as possible before you go to sleep, and also take care of your sleep environment. And self-care can be very time-consuming and a lot of work, but it's the best thing that I can do to manage my health and keep living and get through the day. Daily self-care is critical to us in any way possible to build it into your lifestyle. Because again, as I say, you are your best advocate, and these are things that you can control.
Thank you, Kathleen. I would love to close with a question that looks at the concrete actions both patients and healthcare professionals can take today.
I would say to patients, be informed about the disease, be aware of the changes within your body, and talk to your doctor. That is very, very important. From company perspective, we also want to empower patients to foster shared decision making with the physician and have the right conversation with the physicians. And I think this is also something for the doctors. Talk to your patients, ask the right questions, ask the questions about comorbidities, about joint pain, etc. And I think that really helps to get together and have holistic treatment of the patient.
Well, first of all, we need to talk about it. We need to be partners in care. I just have a new rheumatologist of 8 months, and our first meeting was a good one because I came right out and said, I'm aware of all these comorbidities. I'm really struggling with my psoriatic arthritis, and, I really want us to be partners in my care. And I said to him, I came here to interview you to make sure that we're a good fit because I need to be comfortable to be able to speak up and talk about that I'm not sleeping because I'm in so much pain or I have a lot of anxiety or my knee is swollen and I can't walk. And he needs to also, be comfortable saying to me, I need to be more active or talk about have I seen my cardiologist and did you get your blood work done? So I think that it's really important to be able to have good communications together and to feel comfortable talking about this.
I really love the concept that the person with a condition is interviewing the doctor.
That's what I said. And I'm 60. I felt comfortable saying that. And I said, I'm here to interview you. And then I said, I'll accept you as my doctor. Will you accept me as your patient? And he said, yes. And we shook hands and we have a great relationship.
That's great. Alvaro, what comes to mind for you when you hear this?
Yeah, no, I'm very happy with. I have patients like that, and I like that when they come to prepare, that they have long history with the disease, that they really understand it, that they done their research, that they care about their care. Like, but I like about that they are the best kind of patients because they are very proactive. They tend to do everything, like they tend to do the diet, they tend to do the proactive exercise. So yeah, I think that's very positive, and it's happened to me, like being interviewed by patients, and I'm trying to do my best. I don't know if I would passed the Kathleen examination, but I try to do my best.
That's a great closing remark. And that brings us to the end of this episode of Beyond the Flare. And I want to say a huge thank you to our guests for your honesty and, of course, expertise. And to everyone listening, don't forget to subscribe so you don't miss future episodes. And until next time, take good care of yourself and each other.